It's time for PetSylvania with Dr. Bob Esplin. Dr. Bob guides you through the latest veterinary techniques and procedures to keep your pets in the best of health. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. With your ears up and tails wagging, here is Dr. Bob.
Hi, pet lovers. This is Dr. Bob with PetSylvania on the really big day of the year here. This is Michigan Saturday. And so the Buckeyes and the Wolverines play today at noon in the shoe. It's going to be exciting to see, and hopefully we'll round out a pretty big year. And most of you know that I'm a big Buckeye fan, so go Bucks! And I'd like to thank Elanco for being my sponsor. They make the next generation of flea control products. It's an oral pill called Trifexis, which also helps prevent heartworm disease, and that's for dogs. And then Comfortis, which is a flea control pill only that's for both dogs and for cats. It has approval for both. It is, in fact, the next generation of flea control. Highly effective, very safe, very few side effects, something that's absolutely worth your consideration. Give us a call if you're unfamiliar with it. We'll get you some literature. We'll get you prices. I think you'll be amazed at, if you compare prices, what our prices are, because our prices are really and truly excellent. Sylvania Vet is my office, of course, and we have 6 doctors in addition to me. That means that there's always somebody available and always on call. That's part of our commitment to the community and part of our commitment to clients. It's one of the things that greatly sets us apart from other practices. We are a full-time doctor for your pet. We aren't shutting at 5 or 6 and turning you over to somebody else. We aren't sending you off at the end of the day with your really sick dog to the emergency clinic. We're going to be there. We're going to have overnight staffing to take care of it, and we're going to have a doctor on call to consult should a problem occur. We will be in there if needed. Our doctors are truly dedicated to the pet community and to our clients. We, in addition to being community-minded in that way, we are also extremely community-minded in a lot of tangible ways. We have provided watering fountains on the University Trail, and there's a watering fountain at the Visitor Center at Wildwood Park that we have donated. We do a street pickup for 2 miles from Central Avenue North to Convent. We pick the street up 3-4 times a year. We work closely with several area rescues, providing discounted services so that those animals get the same level of care and quality care that our clients get for their pets. We hold adopt-a-thons every other month. Our next adopt-a-thon will not be until January. Those dates have been established. Provide a scholarship to a veterinary student. The most recently, we donated one. We gave a $2,500 scholarship to a student at Ohio State's vet school who's from Point Place, and so we're very happy to do that. We do a lot to support the local police, including when the Sylvania Township had a drug dog, held a fundraiser that enabled us to buy a bulletproof vest for this officer because police dogs are considered officers of the law. That's a lot of our involvement in the community, and we're really proud to do that. Leptospirosis is a bacteria-like disease that affects dogs. A recent piece of literature indicated that some testing was done at the laboratory in Lansing at the Animal Health Diagnostic Lab, and when they did that, they found that in Southwest Michigan and Northwest Ohio, 20% of the dogs that were tested that had never been vaccinated showed evidence of a titer to 1 or more of 6 different strains of leptospirosis. We consider leptospirosis a very serious disease. Many dogs will die from lepto if they get it. Those that don't die suffer serious consequences, require intense hospitalization, run the risk of exposure to humans because leptospirosis is potentially contagious to people. There are veterinary practices that don't recommend lepto. We think that's a mistake. They're entitled to make those recommendations, but I want you to think about whether or not you want your pet protected, because large numbers of the area wildlife are potential transmitter of that leptospirosis bacteria-like disease. Last week I talked a little bit about anxiety in animals, And so a question has been asked by Steve, what about moving animals into a new home? Well, that's a really good question, and it does have it depends a little bit on what that animal is. If it's cats, that's more stressful and more difficult generally than moving the dog. The dogs seem to adapt pretty well, and once they get a chance to go around, sniff, and understand their territory in the yard, and if you have a fenced in yard, they learn their parameters. If you use invisible fence, that's marked out, and so they know what the new parameters at the new house are. Cats, on the other hand, it can take weeks for them to adjust into a new house, and the best thing to do in a cat is to put them in a room with their litter box and their food and their water all in just one room, and let them settle in and get comfortable in one room, and then gradually expand them into the whole house. And that's, if it's multiple cats, it applies that you may put them in a room together, but we'll see sometimes that'll lead to conflict. So you may have to spread them out a little bit. But it's a good question. And using some of the anti-anxiety medications that we talked about and mentioned the last time, Angstitane, Comfortis, that's the wrong name. Compose is the right name. I get too many of these C words. I was looking in a formulary the other day. A formulary is a listing of all the drugs available to us. There are so many C words. It took about 6 pages to get through all the C's. I couldn't believe it. So yeah, it gets a little confusing because there's also Convenia, which is a injection of antibiotics that lasts for 2 weeks, and then there's another product that starts with a C for vomiting, and I've just gone blank. Too many C words. I'm into C overload here, and that, of course, will come to me. These senior moments seem to come at the most inappropriate time. We had a really sad case this week. It was a dog that came in, and the dog was just out of control. It was thrashing, it was seizing, it was vomiting, and it was just a train wreck. And as we're trying to get the things under control a little bit, get it sedated a little bit so we could bandage it, get an IV in so we could do that, then maybe we could get some blood and start testing. At the same time, we're trying to take a history and try to figure out what did this dog get into, because it was fine, and then the next thing it was deathly ill. It turns out, as the history got taken, and I can't emphasize how important spending the time to get a good history and ask the appropriate questions is to the proper diagnosis, given that our patients can't talk to us. It turns out that the boyfriend of this young woman had changed the antifreeze in the car, and what they had done is just washed it down. It had gotten on the floor, and they had washed it down. Well, it doesn't take very much antifreeze. And this dog did have antifreeze poisoning and had to be euthanized because its kidneys were completely trashed. The ingestion had been about 2.5 days before we saw it. And the only way we can get a dog through antifreeze or a cat through antifreeze poisoning is if we get it right away and we can start treatment. And then we can usually successfully bring them through that. But, that brings to mind, if you're going to be a home mechanic, you've got to use good common sense. You got to use responsible techniques for disposing of these of the oil and of the antifreeze that you drain out and replace. There are laws against dumping stuff in the sewers, so just washing it down means it's going to go to the sewer. So I highly recommend that you check where, like the store where you bought it, or an auto parts store, or check with the city, the environmental department, or even the fire department. They can usually give you some suggestions as to how to dispose of something appropriately and where to dispose of it appropriately. But the sad thing is that there really was no excuse for that poor dog to pass. It's time for a break. We've got some big news starting on the December the 1st. PetSylvania's broadcast time is going to move until noon at WSYL.FM or WSYLradio.com. Either one will get you where you want to go so that you can listen to me on PetSylvania, and you can send questions in as well. So we want you to do that. So December the 1st, look for us at noon, and from each Saturday subsequent there. But we'll also be on on Monday at noon and Thursday at 7. There are rebroadcasts as well. Here we are back ready to go with the next part of that. I want to time for a commercial about Best of. Best of voting is still going on at www.toledocitypaper.com. Please vote for Sylvania Vet for Best Vet and vote for Paw's Sake for best not-for-profit. Happen to be listening to this and you live outside the area, a place for you to learn about other Toledo area businesses so that you can vote is that if you go on Facebook, you go to a page called Help Save Lola, and we have some suggestions for all the different categories that are there so that you can fill out your applications. So I'd like to challenge each and every one of my listeners to challenge you all to get 10 votes for Sylvania Vet and for Paw's Sake. We've won 5 years in a row. We want to make it a half a dozen, and we want to just keep that ball rolling. So please help us out. And one of the reasons why, we are the best is the fact that we don't just do it. We try to do it right. I had a case in today that we diagnosed a dog that had a urinary tract infection. This client was from Monroe. She was in for hydrotherapy. And so she went into her veterinarian. He just prescribed some antibiotics. And then he said, bring in a ladle full of urine when the antibiotics are gone, and we're going to check and see if it's gone. Well, the reality is that you can't tell that way. You cannot use a caught sample to determine whether a dog has a urinary tract infection or if a dog's urinary tract infection is cleared. There's only one way to do it, and it's with a procedure called a cystocentesis. So it's kind of frustrating because now I had a client relation problem and trying really hard not to throw the other veterinarian under the bus. It's common knowledge in the profession that the only way to get to check and follow up on a urinary tract infection is with a sterile urine. And it's really important that you do that. If your dog has had a urinary tract infection, don't just finish the antibiotics. Get it tested and make sure it's cleared. It'll decrease the likelihood that it will come back. It'll decrease the likelihood that the presence of that infection may lead to the development of bladder stones, which now require that we go to surgery to get them out of the bladder. We get a lot of calls sometimes that I think my cat's got an ear infection, and I went to the pet store and I bought some ear mite medicine, and it doesn't seem to have helped. Well, the reality is that unless your cat is an outdoor cat, or unless your cat is a kitten and it hasn't been in and examined yet, or unless your cat has been rolling with a kitten and playing with a kitten that has ear mites, very few adult cats have ear mite infections because once cleared, they don't come back usually, and the opportunity for exposure requires intimate contact with an animal that has ear mites. So cats get ear infections just like dogs do, not as commonly, but they do get ear infections. And so if your cat's shaking its head or its ears look brown, have a lot of brown buildup of wax, or there's an odor or there's a redness, it could be a bacterial or a yeast infection that needs dealt with. One of the great tools that we use at Sylvania Vet on a regular daily basis with almost every animal that comes into the exam room is something so simple, you're going to just shake your head when I tell you one of the most valuable diagnostic tools that we use is a flea comb. We use a flea comb on every animal because you'd be surprised how many animals we look at the skin and it looks clean and we run a flea comb through, and lo and behold, up comes that random flea or a little bit of flea dirt that tells us that we have them. And everybody says, well, how's that possible? My cat never goes outside. Or I only have a cat. And how's it possible? Well, it's possible because you can bring fleas into the home on your clothing. If you have brought a stray cat into the house, they could have brought it in. If you have a dog that goes outside, then they're going to bring fleas in the house. So, one of the things that we have people do is use their flea comb at the end of the day and comb their dog, before it comes in from last call, just to make sure that we don't have any fleas. And that's where the commercial for Trifexis and Comfortis comes in, because you'll have find fewer fleas. But the flea comb is also a great grooming tool, and it helps remove hair that's loose, particularly in cats that might be ingested and lead to a hairball. It helps prevent knots and mats so that your dog or cat doesn't need to be groomed. If your dog has really long hair, really thick hair, really curly hair, a flea comb may be a little hard to get through, but it is a great grooming tool. For $6, everybody should have a flea comb. This may be the wrong time of the year to talk about this, but I think that it's important because we are talking about using heartworm preventive and flea control year-round in dogs and in cats. And so one of the reasons why it's really important in cats particularly is that there's a condition that's called heartworm-associated respiratory disease, HARD. And HARD sounds a little bit like with a cough, sounds like it could be asthma, when in point of fact, it could be triggered by heartworm disease. A cat can be difficult to diagnose with heartworm disease. A cat cannot be treated for heartworm disease as dogs can. So prevention. The flyer that I have here, it says proactive prevention is the only sure way to protect cats against HARD. And then what I wanted to do is talk to you about 5 myths and misunderstandings about feline heartworm disease. It's probably just easier for me to read these rather than try to, paraphrase them. So this comes out of a handout that's put out by the American Heartworm Society to give them appropriate attribution. And it says, dogs versus cats. I thought heartworm disease was mainly a dog's disease. Heartworm disease is not just a canine disease. Heartworms affect cats differently than dogs, but the disease may cause equally serious signs. The reality is that one of the clinical signs of heartworm disease in cats is sudden death. Doesn't get any worse than that. Indoor versus outdoor cats. But my cat stays indoors, so she is safe, right? It only takes one mosquito to infect a cat. And because mosquitoes can get indoors, both indoor and outdoor cats are at risk and should receive heartworm preventive medication. In a North Carolina study, 28% of the cats diagnosed with heartworm disease were inside cats only. There have been other studies that support that as well. That's a higher percentage than I had previously heard. It's a heart disease. How does it affect my cat? The name heartworm disease is a misnomer, as it mostly affects the lungs and is not just the heart. Signs are often mistaken for feline asthma, allergic bronchitis, or other respiratory disease. Adult heartworms versus juvenile heartworms. What if the juvenile heartworm never develops into an adult heartworm? Cats do not need an adult heartworm to exhibit clinical signs. In fact, juvenile heartworms are a main cause of problems. Studies show 50% of cats infected with juvenile heartworm have significant disease of the small arteries supplying blood to the lungs. And finally, diagnose it. Is it easy to test whether my cat has heartworm disease? Diagnosis is difficult, as negative antigen and antibody tests do not rule out heartworm disease. Positive tests, however, are significant. So we do recommend that cats be tested. We aren't doing it quite as much as we do in dogs, but we think it's a really good idea and something that you should think about. Hey, we're back here to wrap up. So this is the last 10 a.m. broadcast, PetSylvania, and next week we will be on at noon, and for each Saturday after that, we will be on at noon. So please remember that. Adjust your schedule so that you're available to listen to PetSylvania at WSYL.FM on Saturday, December the 1st, and each Saturday thereafter. We are going to have Santa pictures on Sunday with your pets, with your family, with the kids. Any combination of that you would like, we will be doing those pictures from 10 until 2. A basic sitting is $22. You get a 5x7 and 4 wallets. There's lots of other things, including cards. We hope that it's early enough this year that if you want to do a family picture and have cards, you got plenty of time to get it out. So give us a call at 419-885-4421 and schedule a time. We're going to do pictures and these are going to be studio quality pictures by a professional photographer from 10 until 2. And we have lots of openings right now, so I really hope to fill up because we'd like to have at least 100 sittings. And then a donation will be made to our charitable foundation for each of those sittings by the photographer. Want to remind you to vote for Sylvania Vet and for Paw's Sake at ToledoCityPaper.com. Best of voting, real important to those of us at Sylvania Vet, and for Paw's Sake is a wonderful rescue. And so as a result, I would like to encourage you to vote for them for best nonprofit. For Paw's Sake, we'll also be selling 4-pound containers of mixed nuts, and we've done this for them about the last 3 years. And these are great nuts. This is a great buy, and something that you'd like to have around for the holidays. So come on in, pick one of those up. We make nothing off of that. Collect the cash and we pass it on, kind of thing. We're just happy to be a venue for Paw's Sake and support them in their fundraising. So Santa pictures and for best vet voting, nuts for Paw's Sake, any number of other things. We've got things going for the holidays on a regular basis at Sylvania Vet. I want to say, go Bucks, beat Michigan. Remember that there's only one greatest pet, and it lives in your home.
You have been listening to PetSylvania with Dr. Bob Esplin on WSYLradio.com. PetSylvania is brought to you by Elanco, maker of Trifexis and Comfortis. Tune in every Saturday at 10 a.m. as Dr. Bob explains the latest in veterinary care and answers your questions. You can email your pet questions to requests@WSYLradio.com, and Dr. Bob will answer them on a future show.